Have you ever found yourself trapped in the labyrinth of your own thoughts, where each turn seems to lead you deeper into darkness? Welcome, dear listeners, to a journey of understanding, a journey that might shed light on these shadows. Depression, a word we often hear, but what does it truly mean? It's not just about feeling sad, it's more complex and multifaceted. Picture an uninvited guest who overstays their welcome. That's depression. It seeps into your daily life, affecting your thoughts, your feelings, and your actions. The symptoms of depression are as diverse as the people it affects. It may present itself as a constant feeling of sadness, a lack of interest or pleasure in activities once enjoyed. It could be a change in appetite, difficulty sleeping or concentrating, or even physical aches and pains. But the most dangerous symptom is perhaps a recurring thought of death or suicide. Depression doesn't discriminate. It can affect anyone at any age from any walk of life. It's not a sign of weakness or a character flaw. It's a medical condition, much like diabetes or hypertension. Yet it's often misunderstood and stigmatized. The question then arises, why do people get depressed? There are numerous factors, from biological to psychological to environmental. It could be due to a chemical imbalance in the brain, a traumatic life event, a side effect of certain medications, or even due to a family history of depression. But amidst this darkness, there's a beacon of hope. Depression is treatable. There are various methods, each tailored to fit the individual's needs. Psychotherapy, also known as talk therapy, is one such method. It involves discussing your feelings and thoughts with a trained professional. Another treatment option is medication. Antidepressants help to correct the chemical imbalances in the brain that contribute to depressive symptoms. Then, there's the option of lifestyle changes. Regular exercise, a healthy diet, adequate sleep, and mindfulness practices can all play a role in managing depression. But remember, it's not a one-size-fits-all situation. What works for one person might not work for another. It's a journey. And like all journeys, it requires patience, persistence, and courage. If you find yourself resonating with what's been discussed, know that it's okay to ask for help. Reach out to a mental health professional. If you're feeling suicidal, call a suicide hotline immediately. There is no shame in seeking help. Depression is a tunnel, but it's not endless. There's light at the end of it. It might seem far away, but with each step you take, you're getting closer. So keep going, keep fighting. You're not alone in this battle. Remember, your mind is a garden. Sometimes it might seem overrun with weeds, but with the right care, it can bloom again. So, nourish it, care for it, and most importantly, be gentle with it. In this vast universe, you're unique, you're important, and you matter. So hold on to hope, because better days are coming. It's okay to not be okay, but it's not okay to stay that way. Reach out, seek help, and remember, you're stronger than you think. Until next time, keep the faith. The darkness is temporary, but your strength is permanent.